do send this recording out. There we go. So we will be sending the recording out. So if you have to leave early or if you want to share it with any of your coworkers, please feel free to disseminate it, but that will go out to you after, like by the end of this week. We'll make sure that you get that. And before I introduce Megan, want to let you all know that next month we're going to be kind of launching from harm reduction and talking more about exploring different pathways to recovery and wellness. So what that can look like. So it's really building off of some of the information that y'all are going to get here today. So we'll be doing that same time, last Wednesday of the month in September. I just want to thank each of you for taking the time for coming. And one of the things that I really love about working here at WeConnect is we have such an incredible team of experts. And we're really fortunate that we have Megan with us, who's one of our peer specialists. Megan is absolutely incredible and is renowned when it comes to harm reduction. So I have learned a tremendous amount about harm reduction, best practices, the history, and I continue to learn all the time from Megan and getting to share space with her. So I'm excited that she's here with us and that she's going to share a little bit more about harm reduction, about the practices that we do at WeConnect, as well as just the overall approach to harm reduction and in recovery. So with that, I'm going to go ahead and toss it to Megan.
Thanks so much, Lauren. Thank you for the warm welcome. And it's really good to be connected with all of you. I see we've got folks from Texas, North Carolina, where else? Tarrant County, Olympia, that's Lauren. Anyway, y'all are all here together from all over, and that's pretty cool. So thanks so much for coming. And it's good to see some of my team here. We have an awesome team here, and it's a great way for you to get to meet everybody. And yeah, I'm going to be talking about harm reduction today, something I'm really passionate about. So let's jump into it. All right. So harm reduction is a pragmatic and evidence-based approach to supporting recovery and wellness. And we're going to talk a lot more about why and how that is and what it looks like. So again, my name is Megan. I like to tell a little bit about myself. I'm a peer specialist. I'm not a clinician. I'm really passionate about harm reduction because of my own lived experience trying to navigate a treatment system and finding a lot of barriers and not as many linkages and bridges as I would have liked to have seen. So it's something I'm really passionate about advocating for and about. And I identify as someone with lived experience navigating chaotic substance use and also mental health challenges. I'm a peer specialist. I'm certified nationally and also here where I'm joining you from in New York State, which I forgot to mention. I'm in New York State in the Hudson Valley region. I'm also a certified wild and medicinal mushroom foraging guide, and I love using fungi and learning about nature to get people outside so that they connect, with community and wellness and the forest and wild spaces around them. So that's just a little bit about me. I also have a dog and a cat who are in this photo. The cat is definitely there in real life, sitting with us on that riverbank, not there at all, but that's her. That's my cat and dog. And I see some of you have introduced yourselves in the chat, but I would love to meet more of you. And if there's anything fun you want to say about yourself in the chat, I always love getting to know people better as best we can in this digital space. All right, so today we are going to be talking about some sensitive subjects and topics, maybe things that everybody's familiar with, maybe not. So we are going to have a very quick overview on how to have courageous conversations. And then we're going to do a very brief history of the war on drugs because it is very relevant, and we will dig into why that is and how that affects people. Then we'll define harm reduction together, and then we'll learn how do you even practice it with your clients, with your family, with your friends, with your community, with yourselves. What does that look like? So onto the courageous conversations. Obviously, astronauts have to have quite a bit of courage. I'm also a sci-fi nerd, so I find as many opportunities as possible to insert that passion into my slides. But a way to have courageous conversations, which are basically talking about things you want to avoid, stuff that might be uncomfortable or unfamiliar that you might have mixed feelings about. staying engaged, experiencing discomfort in your body, and then taking care of yourself when that happens. Walk away if you need to, take a break if you need to. You can go back and watch the recording later if you'd prefer. Staying curious is something that helps me a lot. I have had a lot of resistance to the topics that we're going to start with, and I love leading with that, just so folks know, like I said, I'm someone with lived experience, and I really resisted the concept of harm reduction at first. It was really hard for me, and I've become really passionate about it because over time and unpacking and taking care and staying curious, I've been able to really understand and kind of embody these principles. And so I expect that people may have some tension or some disagreement, etc. So if we can just, lead with dignity, respect, and compassion, which are the philosophies of harm reduction, I think we can get through this and maybe learn from each other. And you can always speak your truth here. I love hearing people's perspectives and lived experiences and believing them because I want to be believed. So again, with the sci-fi, one of my favorite quotes to use for these topics are that nothing in the world is harder than convincing someone of an unfamiliar truth. And this comes from a series of very nerdy fantasy sci-fi books by Patrick Rothfuss called The Wise Man's Fear. And I'm just going to leave it there because it's pretty hard sometimes trying to learn new things. All right, so we're going to start with a very brief history of the war on drugs and start off by kind of just calling it out. Humans have always used psychoactive substances. People have always sought altered states for many different reasons in many different ways. But anyone that learns about history and archaeology knows that they're always uncovering new and interesting ways that humans experimented with substance use. For religious ceremonies, for shamanic and tribal rituals, for pleasure, for pain relief, both mental and physical, boredom, and also creativity. There's hundreds of stories of artists that did some, wild things while under the influence, and also created some really beautiful art. And I just like to include some photos. These are some of the more ancient drug practices, like the Blue Lotus from Egypt, and the one on the bottom right is really interesting. The Greeks, they're learning about how the natural gas coming out of the earth may have contributed to some of the ceremonies and rituals there. And I find it really interesting, and also use it as a tool to engage with people who are using drugs to help unpack shame and stigma. And right here in the US, drugs used to be legal and they used to be regulated, and you could buy them in the Sears Roebuck catalog right next to your overalls or your garden hose or whatever else you needed. In fact, they made cocaine toothache drops for children. That was very common. All these products were things that were available, just in the regular store. You didn't need a prescription or much of a strong reason to obtain these substances. They were regulated. They were safe for the most part. Yes, people did develop unhealthy relationships with them. There were people that developed dependencies, but they were not necessarily ostracized or stigmatized till much later on. And that kind of started with the Harrison Narcotics Act. That was passed to regulate the sale of narcotics. And then, of course, alcohol prohibition, pretty legendary experiment in America from 1920 to 1933. I went to since this is a topic I'm really passionate about, I went to the Prohibition Museum when I was passing through Savannah, Georgia a few years ago during COVID. So that's just a picture of me for fun, standing next to some folks who were not participating in Prohibition and were still imbibing in the alcohol they'd purchased on the black market. And so many things came out of Prohibition, but the one thing we learned is that even though we make something illegal, people still use it, and they just obtained it anyway. They were able to get prescriptions. Churchill is really famously someone who had a doctor's prescription every time he came to the US to get whiskey and to make sure he had his drink. And all kinds of industry and things were dedicated to this illicit market, and it formed kind of the structure we have today for both policing illegal substances and also the selling and buying in the kind of criminal underworld. Back then, believe it or not, people used to murder each other over bars, like where their bar was located. I'm really glad that's not happening today. That we can, have these places and people are able to purchase something, know what's in it, and not risk death because they'd like to experience a drink at a bar. All right, I'm just going to check the chat really quick because I'm seeing some stuff there. I want to make sure I'm not missing anything. Oh, it's just Lauren welcoming people. Thanks, Lauren. All right. So all of these laws that we just discussed led to something that scholars and academics refer to as the iron law of prohibition. And basically what that means is the harder the enforcement, the harder the drugs. The more time, money, resources, things we dedicate to making things illegal and trying to stop people from doing them, the only thing we can study and correlate with those resources is that drugs get stronger, substances get stronger, and they get smaller. And that's to get them into places because, you can't bring a huge thing in if it's illegal. It's much easier to make it small. And these are just a few examples. So, and during alcohol prohibition, right, people were drinking beer and wine and just having beer and wine, some of them to, embarrassing effect and to problematic drinking, and some just for social, events. And then during prohibition, the beer and wine, you needed a lot of it. So they made it smaller. And in order to do that, they made things like moonshine and bathtub gin. And we saw thousands of people die during prohibition because they just wanted a drink, couldn't get beer and wine. They had to purchase bathtub gin or moonshine. And the same, happened with stimulants. And of course, everyone knows now we are in an opioid poisoning crisis where we've all lost someone, we've all known someone, especially I'm sure in this room. And the same principles apply. A lot of people ask me like, well, why is this happening? Well, this has a lot to do with it. Fentanyl is very small, and all these other new agents, xylazine, etc. And we have an unregulated supply that is subject to the same iron law of prohibition, and we're seeing mass deaths occurring from that. So again, the iron law of prohibition is just increasing law enforcement, increasing costs of illegality, and that equals increasing potency of drugs. And I couldn't resist this meme. It kind of sums it up. Like we know that this isn't working. So a lot of us are trying to figure this out and come up with ways that we can kind of acknowledge this very true history and also find a way forward that's healthy for people, where people can be safe, get help if their substance use becomes problematic, and not have to fall victim to this iron law prohibition and all the downsides to this war on drugs. And a study came out in 2023 that was published in the American Journal for Public Health that found that when law enforcement do seizures of people selling drugs, the correlation they were able to find was the only thing they could correlate with these arrests were that more people overdosed in that community. And I had a really unique experience of being in a Zoom room during a meeting with former law enforcement and DE agents who were grappling with this study in real time in front of people, and kind of internalizing that, like, well, what does that mean about our jobs and our legacy and what we're doing? Like, is it useless? Like, what are we doing? And it was a very, very hard thing to watch and experience, but also an interesting thing that these studies are kind of making it to the top level of people who are sort of on the front lines of this war, so to speak, and they're starting to wonder, is there a better way? Is there a way that we can do this where we actually help people? All right, so what does any of this have to do with harm reduction, right? I'm taking us down this dark road, going way back to prohibition, and it has everything to do with harm reduction because the shame and stigma of drug use is directly related to this war on drugs. So I find learning about this to be a very good foundation for building, the house of harm reduction, so to speak, because it affects so many people today. People are living with the impacts of generations of incarceration. Felonies prevent people from employment, school, voting, housing, I've supported mothers who, because they had a felony possession from 8 years ago, are unable to get a job, single moms because they have felonies, or aren't able to go back to school or vote, or do all these things just because they possessed a small amount of drugs or had some kind of crime related to their substance use. Drug testing is unreliable and a barrier for a lot of people to get jobs, housing, and custody of their children. And people with wealth are not nearly as impacted by a drug-related arrest or traffic stop. And our policies and practices and the way we treat people who use substances is shaped by this history that we're talking about. And for me, I like I said early on, I find that validating that, okay, you're someone who's using substances, that's natural for humans to want to seek that. How can we talk about what that's looking like for you? Is it chaotic for you? Some people have this relationship, and at times it's helpful and at times it's not. No judgment, like, how can I support you? I find that talking about this and kind of normalizing this when I'm working one-on-one with someone as a peer support, it builds trust. It takes away the shame and judgment and allows someone to see that I'm just there to help. I'm not judging them. This is a history that goes way, way back. All right. So, like Yoda says, what is harm reduction? Well, it's a very pragmatic strategy. It's almost boring at times, right? It's just a set of practical strategies and ideas aimed at reducing negative consequences that are associated with drug use. And it's also a social justice movement built on a belief and in respect for the people and rights of people who use drugs. People that are part of communities that are marginalized and shamed and stigmatized end up, taking care of each other and doing radical acts of love and compassion when they feel like, they aren't being supported from outside help. And when they're, the way they took care of each other has become the legacy of harm reduction. And it's also based on a strong commitment to public health and human rights. I worked for many years as a peer in, medical settings, worked with, addiction treatment centers, prevention councils, and things like that. In New York State, I used to be a recovery coach. That's what we called this role before. And I'll never forget when I got a job at a reproductive health agency that was starting a medication-assisted recovery program. And I went in there like with my armor on, ready to fight for harm reduction. And I'll never forget how easy it was with these nurse practitioners at this reproductive health clinic. They just got harm reduction so quickly because they work with safer sex and teaching people about reproductive health. And they're like, yeah, people engage in risky behavior, we make it safer. What's the big deal? Like, they just kind of got it. And that was such an interesting experience for me. Recognizes that the realities of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other social inequities affect people's vulnerability to and capacity for effectively dealing with drug-related harm. I should change that to Baby Yoda. It would be a lot cuter, I think. All right, what is harm reduction? Again, it recognizes that substance use is common. It includes a spectrum of strategies from safer use all the way to abstinence. And this is the part I love so much, is that abstinence is harm reduction. It's part of that continuum. It's part of that spectrum. And we'll talk about that more in a few slides later. It's targeting risks and harms to PWUD. If you see that a lot, is people who use drugs. I can't stand when people use acronyms like as if I know what every acronym is. So PWUD is people who use drugs. It's a very long thing to type out, so I replaced it with that for most of these slides. So targeting risks and harms to people who use drugs, understanding the roots of these risks, and tailoring interventions to reduce them. And accepting people who use drugs as they are and treating them with dignity, compassion, respect. One of the biggest tenets of harm reduction and peer support is like, hey, meet people where they're at, or meet people where they are. If you're someone who really feels strongly about grammar, that's what we do. We meet people where they are. And it humanizes individuals that have been stigmatized, criminalized, and deemed as deviant. So if you're someone that would like to learn more about these topics, Maya Salovitz, and I always struggle to pronounce her name, is a journalist and an author who's written many books about harm reduction, including her personal story. And this quote, the concept itself is surprisingly simple. Harm reduction applies the core of the Hippocratic Oath. First, do no harm. And first, do no harm, and to addiction treatment and drug policy, in essence, harm reduction is radical empathy. All right, so we've talked about what is harm reduction. I move a little bit into the why and then the how, but I just want to pause. Is there anyone that has any questions or anything they'd like to put in the chat, or you're welcome to, raise your hand or unmute if you like. I just want to pause really quick because I just covered a lot of stuff. An hour isn't a very long time for this training. So I'm just gonna pause for like 5 seconds. Okay. So why harm reduction? Many people don't seek abstinence as a goal. Yeah, that alone is kind of profound, right? So the first time I went to treatment, I was 18 years old. I wasn't physically dependent on any substances. I was self-medicating for some traumas I experienced. Matter of fact, the other day was the 32nd anniversary of Hurricane Andrew in Miami, Florida, and that's where I picked up a lot of my trauma, was on that night. And I was also just someone that didn't really know myself well. I was 18 years old. I was still figuring out what I wanted, what I didn't want. I was a college athlete that had, gotten into some trouble and wasn't able to play my sport anymore, which was basketball, by the way. And so I was using substances, and they were actually really helping for a while. I like to say a lot of times that these substances saved my life in a lot of ways. I was very deeply sad, unhappy, depressed, confused, scared, like all those things. And so when I was 18, I finally experienced enough consequences that my parents were told, she needs to go to rehab. If she doesn't go, you need to kick her out of the house, and that's it. So that's what I was threatened with. And I tried to be kicked out of the house, but it didn't work for me very well for very long. So I agreed to go to treatment when I was 18 to an outpatient adolescent program. And on the first day of that very first treatment stay, I sat down with my addiction counselor, and I remember he didn't ask me anything. He immediately said, so he leaned in and he's like, you're an addict, right? You have a disease. There is no cure. And you have to go to these meetings, like you're not special. And if you don't do this every day forever, you're going to end up addicted to, heroin and on the street. Like he basically told me what my life would be like if I didn't go to the 12-step meetings and be abstinent. And at 18, that just didn't really sound appealing to me. I tried to go to the meetings, but I was 18 and everybody there was, twice my age. And most of them didn't look like me. Most of them were men and a lot older. And I just didn't feel comfortable there. Some of my trauma is also religious trauma, and they were talking about God left and right, and then saying like, but you don't have to believe God. Your God can be anything. And now I understand that concept, and I do not judge that. And it works really well for some people. But at 18 years old, I didn't understand that. And it was really confusing to me. And I just didn't want that. I didn't want that life. So I was offered full abstinence recovery, or you're out there again. So, I chose out there again because I wasn't chosen any other path. I wasn't offered any other pathways. And that cycle for me continued for many years. So to me, just this, just this statement alone is like revolutionary and could change 18-year-old Megan's life, right? Many don't seek abstinence as a goal for their recovery and wellness. And I have the definition of recovery later on in these slides. And just kind of recognizing that is a very powerful thing, right? And the emphasis on counting clean time can be helpful to some and shameful to others. We host a lot of online meetings here at WeConnect, and sure that we probably have folks that you serve that come, and you know, it's just heartbreaking when I see or don't see, even worse, people who have a reoccurrence, who decide to, you know, use again, that we're counting clean time, and they feel so ashamed, like they can't come back. And when they do, we love saying like, it's okay, like we're so glad you're here. You know, recovery is your own personal pathway. I wish I had had that kind of feedback all the times. I was really trying, but not able to put the days all in a row, right? Um, Medication assisted treatment, while our most effective treatment for opioid use disorder, is stigmatized and unwelcome in many recovery spaces, though not all, thankfully. At that clinic I referred to earlier today, the reproductive health clinic I worked at with the medication assisted recovery program, I had a few folks that would come in that were stable on their meds. They were doing really well. They had gotten a job, they had gotten housing, they had a hobby again, you know, they were feeling good. And they would come in one day and they'd be like, all right, I need to taper, I need to get off. And I'd be like, okay, cool, we can talk about that. Like, you know, before, you know, we before the doctor comes in, like, do you want to tell me just a little bit more about where this is coming from? Or, you know, how come your treatment, your recovery plans changed? And they would say, my sponsor said I'm not clean. They don't let me share in the meetings. They don't allow me to count my clean time. And I'm sick of it. I want to be taken seriously, like in fellowship. And that honestly, then, you know, it broke my heart, because I believe when people are using a medication as prescribed, and, you know, feeling good and getting things back in their lives, that they deserve to feel a part of, you know, the community that's supposed to be supporting them. And so just kind of being able to recognize that it's stigmatized and unwelcome in some of these spaces is really powerful. And guess what? There's another identical meeting down the street from the one this person was going to, that's really welcoming and not shaming and not stigmatizing people on medication. So it's not like a blanket statement, like all of these meetings are bad and these are good. I don't believe in the binary. I just think it's a nuanced thing that people should be made aware of. When they're practicing harm reduction, that, you know, you might experience some shame, but I'm a safe person that you can talk to about that. Anyway, yeah, shame-based and punitive approaches are not trauma-informed and harmful to many. Like the way I was shamed and, you know, told that I was going to become a heroin addict and homeless. He said some more very explicit things that I'm choosing to omit here, but that type of stuff isn't trauma-informed, right? And the spiritual programming in recovery and treatment, while it's helpful to some, may be a barrier to others. And that's the thing that, you know, is a touchstone for me, is that this is such a personal process. And, you know, in order to support people, we have to continuously validate whatever is working for them, whatever their goals are. And most research confirms that abstinence from all substances is the exception, not the norm. All right, so practicing harm reduction. So this little graphic is just using the example of nicotine and smoking. And I thought it was pretty easy to understand. So it's a great example. And it shows the lower risk and the higher risk, and, you know, what that spectrum looks like. And, you know, things like switching to nicotine, switching to e-cigarettes and vaping, switching to tobacco lozenges, switching to chew tobacco. Yes, even reducing smoking, right? Is harm reduction. Actually, yeah, that's a lot of doctors will recommend that that's how you begin your process if you have any desire to change your relationship with nicotine. Well, how about cutting back? Like, would you like to try not having that smoke after lunch, or maybe just don't smoke in the car, right? That's a harm reduction. Oh, cool. Somebody thanks Arthur in the chat. Arthur said there's a study from Connecticut that shows abstinence therapies are shown to be dramatically more likely to experience overdose related to medication for opioid use disorder therapies, and worse outcomes than no treatment at all. Yikes. And Arthur cited that study. Thanks so much, Arthur. I appreciate that. I might steal that study for my next presentation. Appreciate that. Yeah, feel free, folks, if you have anything relevant, to drop in the chat. Even if it does not support my work, I welcome it, please. Thank you, Arthur. I appreciate it. So a way to practice harm reduction, recognizing healthier choices. You know, it's hard to go from 0 to 100 overnight. Noticing and recognizing when folks are making healthier choices. It can be a paradigm shift in their recovery. It builds trust and it motivates people to keep going. When you get to hear like, that's awesome. Okay, you used yesterday. How many days did you use this month? Well, 1. Wow, that's really great. How many days were you using the month before? Every day, 5 times a day. Recognizing those things it can be a huge shift in people's the way they feel about themselves. Celebrating incremental change. Small incremental changes are worth celebrating. Reduction in use or using safer substances is worthy of positive feedback. Sobriety and days in a row is not the only metric for wellness. Validating people's efforts. Change is hard. Change is hard. Validation and acknowledgement can inspire leaps of faith and inspire folks to continue making better choices. The carrot usually works better than the stick, at least for me anyway. I like prizes. I like getting good feedback, right? And it's earned because this stuff is hard. It's not like you're getting a consolation prize, a trophy for just, signing up for the game. Like these are really hard changes people are trying to make, right? You're talking about people's lifeline, the thing that keeps them, feeling no pain every day or feeling better about themselves. And, we're asking people to do really hard things. So we can compliment and support people when they're making small changes, even if they're making mistakes or not doing it all at the same time. All right, so here's some more concrete ways, less philosophical ways to practice harm reduction. Overdose prevention, which includes naloxone and Narcan, which by now I believe most folks are familiar with and might have used even in this room. Some of you, thank you for that if you have. It's a vital tool for people using any illicit pill or powder because we have an unregulated drug supply. It's not just people using opioids that are experiencing these drug poisoning events. Recreational substance users are particularly vulnerable because they do not have an opioid. They have an opioid dependence. These people are opioid naive. They don't take opioids every day. Therefore, when a tiny fleck of fentanyl gets into their recreational substance, they're really vulnerable. I'm from Miami, Florida originally, and a few years ago, this story went, it went international. There was a group of young students from West Point that were partying on South Beach, kind of a rite of passage, I guess, still today for young people. And they were just doing something that a lot of young people do. They were experimenting. They were using a powder that they thought was one thing, and it turned out to not be another. And it is a horrible example. It's a great example of the horrors that can go wrong, that can happen if people aren't practicing harm reduction. So they broke all of these tenets. They didn't test their substances. They all used at the same time, and they all perished, and they were all very young, and it was absolutely heartbreaking and sad. And I hate that happened. And guess what? That story went viral, but that kind of thing happens constantly, all day, every day. It's really sad. So all people who might experiment with substances, can benefit from learning these things. Drug checking is huge, right? Fentanyl and now xylazine test strips and other drug checking tools are critical for both recreational and habitual people that use drugs. So, some places have drug checking programs. New York City Department of Health has a pilot program right now where you can bring powdery residue in, and they put it through this really amazing chemistry machine that I don't understand, and it tests the substances and tells somebody what's in it. That's so empowering. Imagine if those young men on South Beach, that were at West Point had that service. That person could have been a time to chat with them and been like, okay, so here's some stuff we should talk about. Number one, this is not what you thought it was. Is this what you meant to buy tonight? And number two, here's the effects you might feel from this. Is this how you want to feel? It's just a really important tool. It's a prevention tool. Not most places do not have these services though, unfortunately. So that's, a vision for the future. And, fentanyl and xylazine strips are increasingly more available. I forgot to add Next Distro. Maybe Lauren, if you can put it in the chat. Next Distro is a great resource where people can find out how to get these type of services in their town by mail in a confidential envelope. So drug checking, safer use supplies, prevent spreads of disease and protect communities. And the wild thing about safer use supplies is that so studies show that people who utilize syringe service providers, so someone that goes to their local syringe exchange, those people are 3 times more likely to stop injecting drugs. So you hear a lot of like stuff, pushback from people that don't understand. They're like, why are you giving somebody needles? Like, we should be helping them quit. Yes. And that opportunity for them to go to the syringe exchange and talk to someone and be seen and heard and have someone wave and know their name and even maybe give them a hug and care about their safety is everything. It gives them 3 times more likely of a chance of stopping that harmful, practice. So it's a big deal for people to have that human connection. That's what it boils down to. And that statistic is from the Center for Disease Control. The SSPs help those with substance use disorders get needed support, prevent overdose deaths, and reduce the impact of drug use on the community. Most of these places, they do community cleanups. They all go up and they clean up sharps. If there's like a park where something's going on there, they'll clean it up. They volunteer. They really do care about their community. Some of them aren't even people with a history of injecting drugs. They just care and they're volunteering or spending time, to help their community in a problem that they're seeing every day. And then the last one I put, which is honestly the most important one, never use alone. If you know anyone, if you're working with someone that's currently using substances, using alone is, the most risky way to use drugs at this time because of all the things we've already talked about. And if they have no choice but to use alone, they can engage with a spotting service, right? Like Never Use Alone hotline. There's the Brave app that you can, help them download in their phone. I've seen some really innovative programs where folks coming out of prison talk about being more vulnerable to drug poisoning. People leaving prison are many times more at risk of dying from an overdose than someone who hasn't gone to jail or prison. So a lot of the times they're programming cell phones now for the people leaving prison have these spotting apps already in their phone. And the way these work is, it's an app, you put in information, you talk confidentially to someone, you tell them what substance you're using, how much you're planning on using, if you have safe supplies or not. And then, let us know when you're done. And if they don't respond either verbally or through the message within a certain amount of time, that person gets help for the one who's using. And it saves lives every day. It's a really amazing service. And Never Use Alone and the Brave app are both volunteer run. These are volunteers. If you're a podcast person like I am, there's an amazing episode of This American Life, which is a very famous podcast. It started off as a radio show. This American Life has an episode called The Call. And it was the first time that radio show, since it's been around for however many, 30 years or something, did an entire episode all about one story. They normally do like several acts, like act 1, act 2. The entire episode is called The Call, and it's a really, really phenomenal story about someone calling a drug checking service in Massachusetts and who they spoke to and who that person knew and the connection between all of them. It involves a nurse, an EMT, and a person using drugs. Really great story that kind of helps people understand how important these services are. And also as a peer support, a lot of us, when we're trying to get our volunteer hours, need volunteer hours, like supporting people. And I have in my state gotten it approved for peers trying to certify to volunteer for spotting services in order to get their peer support certification. And it's a really powerful experience. As long as you are in a place where you have lots of support and can handle some really hard situations. The name of the podcast is This American Life, and the episode is The Call. And I'll look around for maybe one of my teammates can help me out and throw it in the chat. Thanks so much for the question. Okay. So here are some other ways people are practicing harm reduction. Drug user unions, that's a thing. The opioid crisis has led people who use drugs to come together in unions, growing supportive communities and engaging in advocacy. And these people are finding purpose and connection, and that can be such a conduit for wellness. Thanks, Tyler. You know, a lot of people love to quote Johann Hari, you know, the opposite of addiction isn't recovery. The opposite of addiction is human connection. And these organizations, these drug user unions, these overdose prevention centers, harm reduction in general is a way that people find human connection, and that can be the bridge to whatever wellness looks like for them. Really inspiring to learn about these unions, like the New England Users Union, the little logo I put up there. Overdose prevention centers and drop-in centers. OPCs are facilities designed to reduce the potential risk of drug use, including overdose and unwanted public use. Staff intervenes if an overdose occurs and can connect people with addiction services, social supports, treatment navigation, medical treatment, and more. Really quick personal story about that. I visited New York harm reduction educators in Harlem, which is now On Point, which is the first you know, sanctioned overdose prevention site in the state. And I went there before it was that. It was just called New York Harm Reduction Educators. It's in East Harlem. And at a time in my life where I was at my lowest point for my, you know, chaos and, you know, very unhealthy relationship with substances, I was living in East Harlem, and I was on methadone. I was on medication, and I was trying really hard, you know, to participate in recovery, to be in recovery, to feel better. And I was doing a lot better. I had, you know, kind of like the person I spoke about earlier, I had gotten a job. I had my own apartment in Harlem. Actually, I've been living in New York City for like 9 years and never had my own apartment. I always rented a room. I was so proud of that. I was making art. I was like, you know, making friends. You know, all these things were happening. And yet when I tried to participate in recovery, people were like, why are you on that stuff? Like, you need to get off that. You know, you're not clean. You know, I was receiving that level of shame and stigma. And slowly I started using different substances again. At first, it wasn't problematic, but as I withdrew more and more into myself, it got harder and harder to stay well. And when I went, you know, fast forward to present time, maybe 2 years ago, I went down to New York City and I visited New York harm reduction educators in Harlem. And I left in tears because I used to live like a few blocks from there, and I had no idea that there existed a place that I could walk in and people would like wave, know my name. I could hang out, watch TV, see a nurse, see a therapist, go upstairs and do yoga, you know, meditation. They do qigong and tai chi and acupuncture and like all these things without a requirement. I wouldn't have had to show that I'm clean. I wouldn't have had to show even a health insurance. They just had this drop-in center there where it was a harm reduction drop-in center. I had no idea something like that existed. And I left in tears because I was so moved by this place, but also because like, wow, imagine if that had been there, you know, for me. So I have a very, very strong feeling about these overdose prevention and drop-in centers just as a place for community where people are increasingly alone and shameful and stigmatized and, you know, just getting treated really poorly, even though they might be trying. These are places where people can be treated with dignity, respect, and maybe even some love. All right, moving on to harm reduction psychotherapy. Harm reduction psychotherapy is kind of what it sounds like, right? It's a treatment for an innovative treatment for people with alcohol or other drug problems. And unlike traditional disease model of addiction, harm reduction psychotherapy is a psychosocial approach to understand the complexities of drug use and addiction. This is a place where instead of someone looking at you and saying, diagnosing you as an addict with the disease, they say, oh, what do these drugs do for you? Like, have you ever done therapy? You know, would you like to do therapy? Are you interested in changing your relationship? It's more finding out what someone's goals are, right? Which I think is what a lot of people think they're getting when they recommend a loved one, you know, see a someone for their drug and alcohol problem. But these are specialized ways of meeting people where they're at. Is a harm reduction psychotherapy, and of course, mutual aid support groups. We have mutual aid support groups that are places where people can come together and practice harm reduction together. Harm Reduction Works HRW is a scripted support group. So there's a host that reads a script similar to 12-step meetings and other meetings like that. For anyone interested in practicing harm reduction for any reason, right? There's no requirement of who you are to show up there unless it's a specialized meeting, right? There are some, we call them focused meetings for people who are currently using substances. There's some for only family. There's some for parents in a parenting role, things like that. There's also HAMS, harm reduction for alcohol moderation management. And I think I have that right. All I know is it's called HAMS, and they have a really cute hamster on the website that's like singing. And a lot of people find it really helpful for their alcohol, their problematic alcohol use, or just wanting to cut back, etc. And I see what I did. I combined HAMS and moderation management. So HAMS is just harm reduction for alcohol, and moderation management is its own thing, and that is support for moderating alcohol use. That's a whole community with different meetings where you can figure out how to moderate your alcohol if that's what you want to do. So a lot of people see, sorry for my very obvious reference of these two dinosaurs, an epic battle. A lot of people see it as an epic battle, as abstinence and harm reduction being at odds with each other. Like it's this fight, like it's harm reduction versus recovery, or harm reduction versus abstinence, 12-step versus. That's just not, this is not true, because harm reduction interventions and abstinence-based models are part of a broad continuum of healthcare that don't need to be framed in opposition to one another. People can abstain from some, but not others, and still find recovery. Some drugs and not, people can choose goals to fit a life that feel good for them. Many harm reductionists in this movement are people in long-term recovery that are abstinence-based, who are really impacted by this wave of, losing friends, looking around their 12-step meetings and seeing people not there anymore. And they don't leave that community. They just become advocates for these practices. For some people, abstinence is the best form of harm reduction, if that's their goal. So it's not, it's not a fight. Like, some people are like, yeah, I understand harm reduction. I love harm reduction. And for me right now, abstinence is how I'm going to practice harm reduction, because I don't see myself using substances right now. Thanks, Arthur. Yeah, everyone's journey is their own. No one path to recovery. Thanks so much. Yep, love that. Yeah, so they're not in opposition to each other. People can flow through a cycle of abstinence and then non-chaotic use. So maybe this year, like, oh my gosh, there's a pandemic, I lost my job, like, things aren't great. I probably shouldn't drink right now. Like, I'm seeing that could become an issue. I think I might decide to have, dry January and just continue it to December. As long as it's someone's personal goal, there's no reason why someone can't identify as being in recovery if they feel like they're in recovery. People can moderate one substance and abstain from another. Maybe someone's problematic substance is opioids, and they've decided that that's a drug that they don't want to use ever again. But maybe cannabis, now it's legal in their state, and on top of that, it really never was their issue, and every once in a while they enjoyed using that with their friends safely from a regulated supply that they feel safe with. And again, people can use substances and still identify as being in recovery. We're seeing that increasingly more and more. We're hearing things like Cali sober and this kind of stuff, and they are a lot of memes and jokes, and they're made fun of and all that stuff. But I think kind of like what Arthur said, if that's their path of recovery and they feel good about that, I support that. I support that as a peer. Oh, and here's SAMHSA's definition of recovery: a process of change through which individuals improve their health and wellness, live a self-directed life, oops, forgot the space there, and strive to reach their full potential. So nowhere in that statement does it list abstinence as a requirement for recovery, unless that's someone's goal. And we're all harm reductionists already, right? I love saying that, because there's so many ways we practice harm reduction in our everyday lives, right? It's like, it's like the Bible, not, sorry, that's the wrong reference, but it's like, standard operating procedure. You don't miss alcohols, you don't drink and drive. You try to be careful that no one puts something in your drink. Like, these are things, we're raising children to understand. And that is all harm reduction, right? People using a filtered cigarette instead of, like, rolling their own with no filter is, like, I don't know, an increment safer, right? But that's still a little bit, they're trying a little. um you know Abstaining from illicit drugs, but not legal ones. So a lot of us probably had a cup of coffee this morning. Some of us might have ingested nicotine. Some of us maybe had alcohol last night. Those are all legal substances. So some people, are doing that because they don't want to break the law, which I understand completely. We all drive a car. It's very, very dangerous. I think it might be the most likely way to, put our bodies in danger in this country, and yet we just wear seatbelts and do our best to stay safe. Wearing helmets if you're operating a motorcycle, etc. Masks, sunscreens, moderating foods that are just for pleasure. There's a lot of foods we eat that are not for nutritional value whatsoever. We're just liking it. We're getting euphoria from it. It feels good. It brings us joy, and we're mindful of it. So we're all practicing this stuff. We're already all harm reductionists. And this is a quote from Kate Stringer. It says, when people think of addiction, they may be used to thinking in binaries. Someone is addicted to a substance, or they are not. Someone is committed to becoming sober, or they haven't accepted their addiction. Someone is in rehabilitation, or they are not receiving any treatment. But not only are these binaries around addiction inaccurate, they are stigmatizing and don't leave room for understanding the broad spectrum of substance use disorders and the wide array of treatment options for people with these health challenges. I thought Kate really summed that up pretty well. So I stole it from another harm reduction advocate. And so we practice harm reduction at WeConnect in the form of many things, including a Friday 1 p.m. Eastern and all the other times that are listed there, harm reduction works meeting. And this is an example of a way that people can practice harm reduction together in a meeting format that might be familiar to them from previous meetings. It's open to anyone interested in learning about or practicing harm reduction for any reason. It's a topic or exercise driven meeting, including, like, we show videos, we have had guest speakers. It can be more conversational. We allow people to, give feedback to each other with permission and that kind of thing. We also share lots of helpful resources and support each other using harm reduction. And our team is harm reduction informed. All of us are familiar with how to practice that with people. And how to meet people where they're at in their relationship with substances. We can do wellness planning and safety planning and connect them with these apps and these resources in case someone decides to change their relationship with substances, or is not quite ready to give them up, or is just trying to be safer. Or we've connected a lot of folks with resources for friends and family members. I had someone I was supporting that was trying to get some Narcan, and I sent them the link to the Next Distro site and we went together and checked their location, and they didn't know that there was a Narcan vending machine, like, downstairs from where they were living, where they could get it anytime. So they shared that information with lots of friends and family and people who were feeling worried about their community, and now they're all carrying Narcan. So all of us are able to support people through learning about harm reduction. And this is how the harm reduction works meetings close. So since we are coming to a close, I decided that we could maybe end by reading this script. And this is how we end our harm reduction works meetings. And it says, if you haven't used for a while, please be mindful of decreased tolerance. Use less than typical, use slower than typical, use with others, carry naloxone and know how to use it. Whenever possible, use sterile equipment, take care of yourselves and each other. Please tell others our beliefs and what we know. We exist, we are here. Tell people about HRW and bring them. Help us grow. It seems so simple, right? But, you know, this is the only scripted support meeting where just attending this meeting and reading the script is enough that could potentially save someone's life that day or someone they know. And this is the part where I stop, and I think that might be the last slide. Yeah, then I thank everyone for being here, but I'm gonna go back and ask if there were any unfamiliar truths that people grappled with today, or did you hear anything that you'd like to learn more about? If you want to put a question in the chat or unmute and say hi, you're welcome to, but I usually like to leave at least a couple minutes just in case. And yeah, thank you so much, everyone. I'll stop my screen so we can all see each other for the last few minutes. But thanks so much for listening. I'm going to mute in case anyone has anything to say.
Awesome. Thank you so much, Megan. I really appreciate you just sharing your experience, your stories, and some of those statistics. And also thank you, those of you that shared some resources in the chat. I'm definitely going to be following up on that, Arthur. So anybody have any questions or comments?
From that research, it definitely shows the MOUD has a good outcome, and no treatment has at least a decent outcome, but it is markedly different for folks who try abstinence, and that's because many of them return to use and active use after disrupting the tolerance that they may have had, as well as the other fun things that are happening out on the street level. So, at least in North Carolina, there are a lot of housing programs that we're abstinence only. We're not supportive of any form of MOUD, buprenorphine, methadone, except for injectables. So that's some of the advocacy work I'm currently engaged in, going, well, let's really talk about this for a minute. Anyway, there's a lot of passion there. I don't have time to overwhelm people with the passion, but it's amazing to me that these abstinence-based Christian organizations are, well, we'll help you, but don't you dare take that medicine.
That's really frustrating, Arthur. Thank you so much for sharing that. I've come across that many times in my career and also my personal life, and I know just how infuriating it is. So I really appreciate the work you're doing.
And a resource that may exist for folks depending on your state. There's a lot of states now that have peer-run respite centers that tend to support harm reduction a little bit more, and they have housing resources that they can connect folks to. So depending on your state, I know a lot of them have them, and some they're preparing to start some. So that might be something to look into as a resource as well, or some of those respite centers that do embrace harm reduction strategies. I think we're right at time, so I'm going to go ahead and stop recording.